As the U.S. population continues to age, leaders at hospitals and health systems are increasingly partnering with community-based organizations to address the social and non-medical health needs of older individuals, including nutrition and transportation assistance, social connection, and caregiver support. Area agencies on aging are one of the community-based organizations that hospitals and health systems are forging strong, dynamic partnerships with. Today we have a conversation that explores the ways in which hospitals and health systems are partnering with area agencies on aging, as well as tips on some common pitfalls to avoid in these partnerships. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hetterly with AHA Communications. Nancy Myers is the Vice President of Leadership and System Innovation at the AHA, where she leads strategy and programmatic work on population health that supports hospitals and health systems and their strategic partners to equitably support the health of the communities they serve. Marisa Scala-Foley is the Director of the Aging and Disability Business Institute, a part of USA Aging. The Business Institute provides community-based organizations with tools and resources they can use to successfully adapt to a changing healthcare environment, enhance their organizational capability, and capitalize on emerging opportunities to diversify funding. Now, let's join Nancy.
Thanks, Tom, for that introduction, and welcome to all who are joining us today. We're here to talk about clinical community collaborations and specifically the work that's going on to support older adults throughout the United States. We know that we're all getting older and that we have an aging population, and we also know that geriatric services are becoming more and more widespread. We also know that our hospitals and health systems are reaching into their communities in more meaningful ways to partner with community organizations to continue to meet the needs of individuals and their families as they transition out and back to their homes and community settings. So, we wanted to talk about how that looks when it comes to age friendly care. We talk about age friendly in terms of supporting older adults with interventions to improve mentation, support their mobility, work on medications and not over medicate them, and really focus on that fourth M of what matters. And important organizational partners out in the field include our area agencies on aging. So I'm joined today by Marisa Scala-Foley from US Aging to talk about what partnerships are looking like between hospitals and health systems and area agencies on aging. So, Marisa, welcome. And wondering if you could start us out by just giving a little overview of what are area agencies on aging and what is the work that they're doing in communities today.
Thank you so much, Nancy. It's really a pleasure to talk with you today because we believe that partnerships between hospitals, health systems, and area agencies on aging are really critical in terms of community support and addressing both health and social care needs. So, area agencies on aging came about by virtue of the Older Americans Act, which was passed in 1965, right around the same time that Medicare and Medicaid were passed. And the Older Americans Act really is about these community services for older adults. It created the National Aging Network, which has federal components, state components, and at the local level, area agencies on aging. And it's really the core of the Aging Network's work today. The Older Americans Act applies to those who are age 60 and older, and it targets services to older adults, in particular those who are frail or vulnerable, as well as special populations, including racial and ethnic minorities, veterans, people with limited incomes, or people with limited English proficiency. The National Aging Network that was set up through the Older Americans Act points toward 5 core services that area agencies on aging provide. And I should say all AAAs, and we're talking about area agencies on aging there and not the Automobile Association. We get that a lot. play a key role in planning, developing, coordinating, and in some cases, delivering a wide range of long term services and supports in their community. So they do a variety of different things within their community, but they provide services in five core areas. And those areas include caregiver support services, elder rights services such as abuse prevention and long term care ombudsman programs, nutrition services, health and wellness programs, including falls prevention programs and self management programs targeted toward people who may have chronic diseases. And then finally, a big category called supportive services, which include information and referral, in home services, transportation, care management, home modifications, legal services, and a variety of other kinds of supportive services within their community.
So, talk a little bit, Marisa, about how AAAs and are becoming partners to healthcare systems and what those partnerships are looking like out in the field.
So AAAs have a variety of different kinds of partnerships within their community. Some of those may be informal partnerships, others may be more formal and take the form of contracts. We know that from our last survey of area agencies on aging in 2019, that about 80% of AAAs reported some kind of a partnership with a hospital or health system within their communities. But part of what I do at US Aging is to direct a program called the Aging Disability Business Institute, which seeks to build the capacity of area agencies on aging and other aging disability community based organizations to partner and contract with different kinds of healthcare organizations like hospitals and health systems, health plans, accountable care organizations, VA medical centers, and a host of other healthcare providers and payers. So we know from surveys that we do to gauge the extent to which community based organizations like area agencies on aging are, in fact, contracting with hospitals and health systems and other healthcare entities, that there's a fair amount of contracting actually that's happening between area agencies on aging and hospitals and health systems, accountable care organizations, and other kinds of healthcare organizations. About 47% of area agencies on aging reported having one or more healthcare contracts within their community in our last survey. About 21% of those contracting area agencies on aging had contracts with hospitals and health systems, and 12% had contracts with accountable care organizations. And through those contracts, they serve a variety of different kinds of populations who have complex care needs, as well as other kinds of high risk populations, people who may be at risk for hospital readmissions, people with behavioral health needs, people who may have housing needs, and more. And they're providing a variety of different kinds of services under contracts. And we took a look at the survey to see what kinds of contracts that AAAs, what kinds of services AAAs had included in their contracts with hospitals or health systems. And at the top of the list were evidence based programs, such as falls prevention programs, chronic disease self management programs, medication reconciliation programs, transitions from hospital to home, including discharge planning and hospital readmission prevention programs, as well as assessments or screenings for social determinants of health needs. So there's lots of ways that contracting is happening, and we're really excited to see that it continues to grow as we do these surveys.
That sounds great, and happy to hear that the numbers are growing over time. So, let's talk a little bit about the importance of the relationship between the two organizations because hospitals and health systems and ACOs and payers are very complex organizations and sometimes difficult to navigate. And then community based organizations like the AAAs, have oftentimes a very different business model and way of providing services. And you've been working in that intersection space of trying to smooth the waters and help folks figure out a pathway where they can come together and provide services, in this case, to older adults and their families. What do hospitals, let's talk about from the hospital perspective first. What is it that hospitals and health systems and their leadership should understand about the world of community based organizations as they're coming to that partnership discussion or the partnership table? What do they need to understand about the challenges that are faced by a community based organization, the assets that the CBO brings, the community based organization brings, and the challenges that they have?
So I guess the first thing that area agencies on aging would want hospitals or health systems to know about them is that just like you have medical care specialties, cardiologists and pediatricians, and a host of different kinds of healthcare experts in different fields, area agencies on aging and many of the community partners whom they work with are the social care experts or social care specialists. So they really understand and they have the eyes and ears in the home that can really be an extension to the kinds of acute care services and healthcare services that hospitals and health systems are providing. So they may see issues that a patient, an older adult, or a caregiver might not tell a clinician in a hospital or a health system or a physician's office. So they're providing that social care. They can provide those connections to services that can help support your patients at home, whether that is transportation to follow up medical visits after a discharge from a hospital, or nutrition services that can support an older adult post discharge. They also work with different kinds of populations. More than three-quarters of area agencies on aging also work with younger populations. And those can include people, younger adults with disabilities. It may include caregivers. It can include veterans. So we're providing a range of social care services across different kinds of populations. The other thing that I think area agencies on aging would really like hospitals and health systems to know is that, and this is going to sound pretty basic, but these services aren't free. We, as a network, as the Aging Network, are funded very differently from hospitals and health systems. I mentioned before that the Older Americans Act came about at the same time as Medicare and Medicaid. It establishes service programs that older adults, people over age 60, and caregivers can access within their communities. However, unlike Medicare and Medicaid, Older Americans Act funding has remained flat for many years. And in fact, it's been largely flat for decades now, with the exception of the past couple of years when COVID relief dollars have provided additional funding for services such as nutrition services, services that address social isolation among older adults and caregivers. So the Older Americans Act is not an entitlement, whereas Medicare and Medicaid are, which means that the Older Americans Act, largely the funding comes through states to area agencies on aging in the form of grants. So once those funds are gone, they are gone. And there may be waiting lists for services that patients who are being discharged from hospitals or health systems need. There may be waiting lists for the kinds of services that older adults or caregivers being discharged from hospitals or health systems might need. So that is why in the work that we do, that we really emphasize that if area agencies on aging are in fact helping health plans and health systems to achieve better health outcomes, that there need to be more formal contracts for the kinds of services that area agencies on aging might provide.
That's really helpful. And yeah, it's always that financial partnership that's the toughest to figure out. So I'd ask the question, same question, but in reverse. So I asked you, and you just gave some insight into what hospitals or health systems need to understand or think about in terms of viewing the eyes through the AAAs of the world. What is it that your experience you find that leaders of community organizations like the AAAs often don't understand about the healthcare system? So, what is it that we should know as healthcare leaders when we're coming to the table? What information can we bring with us to help in that conversation?
And that's a great question, Nancy. I think, what we've found as we work with area agencies on aging and other kinds of aging and disability community based organizations is that often there's I think one of the areas that they often don't get are some of the voluminous, I think, compliance rules and regulations with which hospitals and health systems and health plans need to comply. And those rules will often pass through to organizations with which those healthcare organizations are working. And so it is an area that we, along with others, are really working to provide education, to familiarize area agencies on aging with, and to really build their capacity in those areas so that they can be good business partners with hospitals and health systems and to be able to serve your patients in the best way they know how while still satisfying the compliance rules and regs that you have to deal with and also the quality metrics that hospitals and health systems are trying to achieve.
Yeah, I think that we hear that as well in our conversations with health systems that seemingly everyone has heard about things like HIPAA around patient privacy or the CMS quality metrics, but the devil is kind of in the details in terms of understanding what really has to be documented, what really has to be done and provided for individuals in order to meet the expectations. So that's a great point of just being really open and transparent and addressing that early in the conversation. I'd like to shift a little bit. You said something a moment ago about, as we were talking about the funding of AAAs, and you mentioned that COVID had a little bit of an impact on funds that were available. So I want to ask you the broader question too. We've been through a lot as a country in the last couple of years between COVID and the impact of the pandemic, the social justice movement that has been reawoken or renewed over the last couple of years. And I'm wondering, have you seen a difference or an acceleration at the community level in the partnerships that are happening? Is there any kind of a catalyzing effect that you're seeing as a result of the shift that we've had to make in the last couple of years and the advancement of equity as being front and center to the work that we do?
I think there are a number of things that are driving and accelerating really this movement to align healthcare and social care. And you've pointed toward a couple of them, particularly when it comes to social justice and the pandemic. The aging of the population, I would also throw in there. I think you mentioned that a little while ago. And we know by 2030, 1 in 5 Americans will be age 65 or older. And we also know that about 90% of older adults, when asked, say that they want to continue to live at home. So that aging of the population and the intersection of that with the health disparities and health inequity that we know exist really is driving us toward the collective solutions that we need in order to be able to target those health disparities, to improve health equity, but also to give all of us really the system that we want when as we age and continue to want to live at home. So it really does point us toward these cross-sector partnerships. Healthcare has a view and a lens into people's healthcare needs and the systems that they require that social care organizations may not have in the community. Likewise, there are services that organizations like area agencies on aging and other aging and disability community based organizations provide that really can complement what the healthcare system is providing in terms of medical care or acute care. And it's really going to take all of us to come up with those concrete solutions that will move our country forward in addressing these issues.
So, as our conversation comes to a close, you raised so many good points. And I always like to end with the question of where do we start? So we've got an audience that's listening to us today, comprised of folks who are working mostly in hospitals and health systems and are on the front lines of leading the work around community health, population health, health equity. If they haven't begun or aren't very far in their journey in terms of partnering with organizations like their local AAA, what's your advice? Give us some tips in terms of what to start with or what to do and or conversely maybe what not to do as we move forward on that journey.
So I would say strong, sustainable partnerships between hospitals and health systems and area agencies on aging and other aging and disability community based organizations really need to start with a shared mission and vision and real flexibility in terms of what those partnerships look like. We've seen a lot of success in these partnerships between healthcare organizations and social care organizations when both partners come at this with the ability to think about, well, what we need right now, but have the flexibility to adjust based on what that partnership learns about what the needs are of the people whom they're serving. So, really, the flexibility is key to some of these partnerships, as well as that shared mission and vision. I would say the other piece of it is having the systems in place that allow for those partnerships really to flourish, whether those are data systems or communications between partners. Those are going to really be key to helping these partnerships to sustain and grow. And the ability to work together in order to address issues that may come up as the older adults, the caregivers, the persons with disabilities are being served.
Thanks. That's great advice for folks at any stage, but especially at the starting stage. Risa, thanks so much for your insight today. We really appreciate you and the work that you're leading with the team at US Aging to support folks across the country. Thanks to all of our listeners today. We really appreciate all the work that you're doing each and every day to advance health in your own communities. Join us again for more conversations and take care.